Hey, and welcome to The Explainer. You ever look at a map, maybe of health outcomes in a city, and notice that some areas just seem to have all the luck, whether it's good or bad? Well, today we're going to pull back the curtain and dive into the science of spatial analysis to really understand the hidden patterns in all that health data and, what they're trying to tell us.
So, right off the bat, here's our big mystery. Why does it seem like certain diseases pop up in one neighborhood way more than another? Or why do people in one part of town have great access to clinics while others don't? Is it just random chance? I don't think so. It's kind of like a detective story, and believe it or not, the map itself holds the biggest clues. All right, here's our game plan for cracking this case. We're going to start with the mystery on the map. Then we'll uncover the golden rule that basically explains why these patterns happen. After that, we'll look at the tools we use to get the big picture, and then we'll zoom right in to find the specific hotspots. And finally, the most important part, we'll see how all this detective work leads to real-world solutions. Okay, first things first, when you and I look at a map, our brains are literally wired to find patterns. We can't help it. But in this investigation, our very first question has to be, are the clusters we think we're seeing actually real, statistically speaking, or are our eyes just playing tricks on us? Is it just random noise?
Now, check out this map. I know, it shows burglary rates, not health data, but the principle here is exactly the same. You can clearly see some areas where incidents are really concentrated. The point is, whether we're talking about crime or who people vote for or disease outbreaks, things in the real world often clump together. And to understand why, we need a guiding principle.
And that guiding principle, well, it's the first major clue in our investigation. It's a concept that's so fundamental to all of this that some people call it the first law of geography. Honestly, it's the key that unlocks everything else we're going to talk about. And here it is, spatial autocorrelation. It's a pretty fancy term, but the idea behind it is actually super simple. Things that are close to each other tend to be more alike than things that are far apart. That's it. In public health, this happens for all sorts of reasons, right? People in the same neighborhood might be exposed to the same environmental factors or have similar access to grocery stores, or they spread ideas and even diseases through their social networks. So this whole idea comes in a few different flavors. Over on the left, you've got positive dependence. That's the clustering we're usually looking for in health data. In the middle, that's just a random independent pattern, kind of like static on an old TV. And on the right, that's negative dependence, where things are spread out evenly, like a checkerboard. Most of the time in our line of detective work, we're hunting for that clustered pattern on the left. So we know that patterns probably exist because of this spatial autocorrelation thing. But how do we actually prove it for an entire map? This brings us to our first set of tools, global statistics. The best way to think about this is like getting an all-points bulletin for the whole city at once. What a global statistic does is it boils your entire really complex map down to just one single score. It's amazing. And that one number tells you overall if you're looking at a clustered pattern, a dispersed one, or just random noise. It's that first critical step that lets us say, okay, yep, there's definitely something going on here. This case is worth pursuing. But here's the catch. A single number that just tells us there's clustering somewhere on the map isn't all that helpful in the real world, is it? It's like a detective knowing a crime happened somewhere in the city, but having no idea what street it was on. To actually make a difference, we have to know where the clusters are. And to find those specific streets, we need a whole new set of tools. It's time to put away that wide-angle lens and get out the magnifying glass. We need something called local statistics to find the actual fingerprints on the map, the exact locations of those clusters and outliers. This slide here just breaks it down perfectly. Global statistics, they give us that one value for the whole map, and they answer the question, is there clustering? But local statistics, they give us a value for every single location, and they answer the really important question, where is the clustering? It's the difference between surveying the crime scene from the doorway and getting in there to dust for prints. One of the most powerful tools for this job is called LISA. And what's so cool about it is that it doesn't just find a cluster, it tells you what kind of cluster it is. For example, a high cluster means you found an area with a high rate of something, and it's surrounded by other areas that also have high rates. That tells us a lot about the nature of the hotspot. Another really essential tool is the Geddes Ord G-star. Yeah, it's a mouthful. You can think of this one as a specialist. Its entire job is to find those statistically significant hotspots, those really intense clusters of high values, and also cold spots, which are just clusters of low values.
These are often the places that need the most urgent attention from public health officials. Okay, so we found the hotspots, we've identified the cold spots, we've done all this cool detective work. But why does any of it actually matter? The answer, the payoff, is how we turn these maps into real action. Take a look at this map. It's showing farmers who decided to adopt TB controls versus those who didn't. You honestly don't even need a fancy statistic to see the clustering of the adopters, the little dots. This immediately suggests that the decision to adopt this health measure wasn't random at all. It was probably influenced by their neighbors. Just understanding that simple pattern is the first step to creating way more effective health campaigns. And this is where all our detective work really pays off. By identifying those hotspots, public health agencies can target their limited resources. We're talking mobile clinics, testing kits, educational flyers, exactly where they're needed most. They can model how a disease might spread. They can pinpoint so-called healthcare deserts. They can even start asking brand new questions about why a disease is popping up in one place to begin with. So we've really been on a journey here. We started out with a map that was just a confusing, mysterious pattern. But by applying the rules of geography and using the right tools, we've turned that mystery into a clear, actionable insight that can actually be used to improve people's lives. That, right there, is the incredible power of spatial analysis. And that kind of leaves us with one final thought. Every city, every town, every single community has this kind of data. So the real question is, what hidden health patterns, what untold stories are just waiting to be discovered in the maps of your own community?